what's the best way now of dealing with the virus and dealing with its spread? Should there be a lockdown? Should there be more restrictions? What form and nature will these restrictions take? Joining us on this special edition of the News Track, I want to welcome Uday Kotak, Chief Executive Officer, Kotak Mahindra Bank and President of CII, TV Narendran, CEO and Managing Director of Tata Steel, Sanjiv Bajaj, Chairman and Managing Director of Bajaj Finserv, Banerjee, Director General CII, Dr. N Trehan, Chairman and Managing Director Medanta, the Medicity, and Dr. R Guleria, Director of the All India Institute of Medical Sciences. Mr. Uday Kotak, to you first. The reports filed by our correspondents from all across the country bring out the dire situation in India's hospitals. There is panic all over. People are deeply concerned about the way the virus is spreading and about the availability of hospital beds. As the President of CII, how do you think we should be dealing with the current spread of COVID? There is a debate in Maharashtra, in Delhi, about whether a new lockdown is inevitable. If it be so, what form and nature should this lockdown take? Mr. Uday Kotak.
Thank you, Rahul. My first focus is on do whatever it takes for production, supply and distribution of vaccines. I do not want to get into the politics whether there is vaccine supply, not supply between center and states, or between producers of vaccines and buyers of vaccines. I want to focus on the simple issue. There is a crisis, and compared to 1 year ago, there is a very big solution in terms of the vaccine. Let's do the math. 130 crore Indians into 2 is 260 crore vaccine shots we need. Even if we want to vaccinate 50% of our people, we need 130 shots. And we should be doing 50% of our people in 6 months. That brings us to an average of more than 20 crore vaccines per month. That's what we need. And what is it that we are doing to increase the production, supply, and thereafter distribution of these vaccines? The current production is much less. We are dependent on only 2 suppliers. For whatever reason, the capacity ramp up has not been higher. The fact of the matter is, I'm delighted that we opened up for Sputnik. I'm also very enthused by the Prime Minister's call about Tika, 11th to 14th April. We now need to support the government and work together to increase the production and supply of vaccines. And we, as business and industry, are ready to do whatever it takes along with the government for increasing the production and supply. If it means importing, we should be ready for that for supply. If it means putting in more capital quickly, if there are issues of capital, we should be ready to do that. There is no cost which is a few thousand crores worth saving for the sake of all Indians. Vaccinate, vaccinate, vaccinate. That has to be mantra 1. In addition to that, we must stop all public gatherings, more than 10 people in any part of the country. 3, keep the factories open. The problem is not the factories. The problem is administration of cities and people discipline. And finally, if we are keeping public transport open, allow 1/3 of the seats available on that public transport to be filled. We need to act now. We need to act urgently. And to start with, put our minds together. Forget what has happened. We are in an emergency. Let us get to 20 crore plus vaccines a month in the next 30 to 60 days.
Dr. Guleria, this is a rare opportunity where you have access to capital, you have access to some of the finest industrial minds in our country, not just banking but also manufacturing. Is there a way in which you believe we can actually ramp up capacity? We're currently producing about 65 million doses. Mr. Uday Kotak says we need to take it up to what, 200 million. If you have all the access to finance, intent, desire, what do you think needs to be done to be able to scale up from about 60 million to 200 million?
Firstly, I think although vaccine is one solution, it is not the only solution, because for vaccines to be effective and to really show their effect, it will take almost 6 to 8 weeks and after the person has been vaccinated. The second important issue is to remember that producing vaccine is much more complicated than producing drugs. You could easily set up a company to make an antibiotic or a painkiller, but vaccine manufacturing is much more complicated. The platform that we use, whether it be the viral vector platform or inactivated virus platform or the mRNA platform, are much more complex. And therefore, even if we had all the money and we were to ramp up our production, we would need to set up new plants, and that would itself take almost 3 to 4 months in the minimum. And therefore, I think the solution lies in doing 2 or 3 things. One is trying to see how many vaccines we can get from outside, and if we have suppliers who can supply it to our own country, we should try and look at that. Second is, of course, to see whether we have people who are manufacturing vaccines which may not be the COVID vaccines but have a plant which is there, and the companies in India can have an MOU with them, and they can also get involved in manufacturing the vaccines which are being made in India. But that needs to be done. That can also be done. But having said all of this, I still think it will take a long time for us to reach the target that we're looking at of the numbers that we have in our country. And therefore, along with vaccination, we have to work aggressively on decreasing crowds. Our hospitals are getting overrun. We're having a huge problem in terms of the number of cases coming to the hospital, and the healthcare system is very badly stretched. Unless we bring these numbers down urgently, there will be a huge crisis as far as admissions are concerned and beds are concerned. So I think we need to really work.
Dr. Trehan, do you have concrete ideas on what should be done to bring down the spread of the disease, to bring down the flow of patients to hospitals such as yours or AIIMS or elsewhere? And there's a big debate which industry is very worried about at this time about whether another lockdown is inevitable. We spoke to the Chief Minister of Delhi yesterday. He and the Chief Minister of Maharashtra said essentially the same thing. If our hospital facilities get run over, we have no option but to go for a lockdown. Dr. Trehan.
So, we are staring at really a very, very, very serious situation, much worse than we were in the first spike that we saw. So the question right now is that, as the previous speakers have outlined already, one, of course, the vaccine is going to be essential as part of the armamentarium. The second thing is, before I advocate a country lockdown or a city lockdown, there are 2 things we can do. And that is appeal to the public. And this should be a continuous appeal day and night, because this is time to actually be scared for yourself. And if people are scared for themselves, and they can be nudged into actually practicing the COVID appropriate behavior religiously, like we do with anything that is related to religion, we shall then be able to break the chain, or at least make our individual effort to do that. The second thing is that, like the previous Dr. Guleria said, cut down gatherings. There is no reason that we should allow marriages with 200, 150 people. We should just limit it to 5-10 members of the family. Any gathering, and no social gathering should be allowed. Yes, there will be some fallout on entertainment and on the food industry and all that, yes. But that is a small price to pay as compared to locking down the country, because that will be economically a major disaster for individuals, the people who are dependent totally on their daily bread. So I think those 3 things that have been repeated already, the appropriate behavior, the cutting down on all gatherings, and vaccine, these are the 3 elements that must be enforced right away and locked down selectively.
TV Narendran, Uday Kotak spoke of ramping up capacity for manufacturing vaccines. Now, this is not really like any other industrial sector where you can divert plants and factories and start producing more vaccines. Do you have any concrete ideas about how you think this can be done? You're working across pharmaceutical companies, vaccine manufacturers. Have you heard back from them? Is there a desire to move existing vaccine manufacturing capacity for this national ramp up for manufacturing the COVID vaccine?
Yeah, so thanks, Rahul. I think what I'm hearing is there is capacity in the country which is not fully utilized, or which can be ramped up much more than it is today by the existing vaccine manufacturers. So I think that's one. We should exploit that. It may not solve the problem fully, but it can get us to a better place than we are today. And I think so that's a discussion between the government and the vaccine manufacturers, and CI has also been facilitating that. CI has also said that the private sector is also happy to import vaccines if required, because we can help in the process of augmenting the supply in the country. So I think these are two things, and appropriate behavior. I think these three will certainly help us. I think in all these options, we have not fully leveraged the potential that there is.
But none of you have spoken so far about the gorilla in the room, the 300-pound L word, the lockdown. Sanjiv Bajaj, we saw how the first lockdown broke the back of the Indian economy. Do you think it's inevitable that there be another lockdown? If there is another lockdown, what form should it take? How can we try and prevent the spread of the virus to the extent possible without killing the economy again?
Rahul, it's not inevitable at all. While we have some very high cases in Mumbai, in Pune and a few other locations, it's still limited in terms of high numbers to a few states. It can of course increase, and that's where, as CII and as the earlier speakers have said, we need urgent action. We need to take all the safety precautions that we've been talking about for the last 1 year. We need to stop gatherings. That is a single biggest super spreader event. More than 10 people, whether meetings, any other private gatherings, public gatherings, must be stopped. As far as people are concerned, at the workspace, organized offices, whether it's factories, that's where things are more organized. We can keep people safe. It removes those many people from public spaces, giving our police and others some breathing space as well. So that must be encouraged. People must work from home where possible. Public transportation, as already said, focus on 30% capacity. We just need to wear our mask, make sure the spread events get controlled. And this will come back in control with all the other things required. So we anyway, in places like Maharashtra, we need a couple of weeks for all the action already taken. The lockdown is going to hurt us significantly on the economic side. Let us remember, last year, our government and RBI tremendously supported the economy. But we are not the US, we are not the UK, we can't freely print money. We will not be able to do the same thing again. And that's why, as CII, as business, we need to work hand in hand with the government. We need to do our bit by being open, by taking all the necessary responsibilities. But each Indian has to take that responsibility seriously.
But Chandrajit Banerjee, people who are watching you on this broadcast will turn around and say that the onus is very unequal. We're allowing mass religious congregations like the Kumbh at Haridwar, in Tamil Nadu, Assam before this, and now in West Bengal. All our top leaders are doing huge rallies without masks, thousands of people attending those rallies, stuck right next to each other. Those are super spreader events. Whereas for people like us, if we're in a car, we're being told that even in a car you keep your mask on or you'll get challaned. So people are saying, why are rules not being applied equally? How do you cut down on gatherings and ensure that rules, Mr. Banerjee, are equally applied to all?
So if you see what we have said very clearly, point number one, that the onus is on every one of us, and every citizen, every stakeholder, everyone needs to follow. And the recommendation that CII has strictly given, that follow protocols across the spectrum, and everyone should, we should not have any type of meeting or gatherings which are held in the country comprising of more than 10 people permitted for that purpose, is what we are saying. So following of the safety protocols, enforcing of the safety protocols, enforcement of it is important. And we are saying that industry should only shoulder the responsibility, should have equal stake in enforcement, in spreading the message. It's important to spread the message, and it's also important that everyone gives a shoulder to this very, very important area of enforcement and practice. And therefore, what we are saying, that while we have said, and Sanjiv was speaking about what we have said, that we don't need to have the lockdowns, because we feel that when our workers are in the factory premises, they are very safe. They are safe because protocols are being observed, and we have strict protocols amongst our membership. industry. We have sent many circulars out. Many members are participating. Members are also tweeting the importance of social distancing, wearing of masks, sanitizing, and so on and so forth, and even social distancing at the workplace. So I think we need to see that as a country we behave very, very responsibly.
So what's very clear from what I can gather, Mr. Kotak, none of the representatives from industry, and very naturally so, want a full, complete lockdown. When do you think the point comes when everybody just turns around and says, even if we don't want it, it is inevitable, and now the conversation veers to what form and nature that lockdown takes, rather than whether there be a lockdown at all? Mr. Kotak.
So, Rahul, if you look at Maharashtra, Maharashtra was the first state to really rise. The other states are now beginning to rise. And I'm again coming to the point, which is, yes, we need to address the issue of the lockdown. And my view is factories open is better than factories shut. Okay, that is my fundamental view. The problems are elsewhere. We as a nation should stand as one nation and one people. We should keep aside our differences between politicians and people, between center and states, between vaccine negotiators and vaccine producers. We are one nation. We should not worry about anything else but getting our stakes up on the 4 or 5 points we mentioned. And we should get beyond issues about negotiations. We should say the country needs a few thousand crores, if necessary, to be spent on imports. We must get the best vaccines. If either we can make them here, or it will take time for capacity. But the need for vaccines is now. And this has been clear. I mean, if you look at the calculation, this calculation has been known to us for some time. Why? We should act with speed and alacrity. And I don't want to look at the rear view mirror. Why did we not do it in February or March? That's quarter behind us. Let's do it now so that by June, we are getting there, as the risk of this is it will spread state after state. And it is very important that we get our focus right. And in addition to that, public gatherings. Why are we shying away from that?
Dr. Guleria, you're on the government's task force for COVID. Let's put some tough questions to you. The government's accused of wanting to over-centralize, to control the entire vaccination process. Is it fair to say the government didn't scale up manufacturing of vaccines, didn't give approval to Sputnik, Pfizer, Moderna, which have, proven their efficacy after phase 3 clinical trials internationally without insisting on bridging trials over here, as was done, for example, for Bharat Biotech? The full results weren't out, but you gave permission for them to ramp up. And now, when everyone is saying, let's import if we can't manufacture, do you have a plan to import? Because every country is first trying to produce for itself, and the US, where now they're reaching a level where they can start exporting in a few months, but they already have people to export to, and they'll charge rates which India may not be willing to pay.
So that's the point. I think there are two important points. As far as Bharat Biotech is concerned, the studies are already being done in India. As a matter of fact, the largest study of for the vaccine in India was done by Bharat Biotech. Even the AstraZeneca did a bridging study of only 1,600 patients, whereas the Bharat Biotech study has 25,000 patients. So the number is much more, although they had limited phase 3 data when it was given emergency use authorization, although only in a clinical trial mode. As far as vaccine is concerned, a lot of companies had approached the regulators. As far as I know, Pfizer had approached the regulators in the beginning, but they withdrew their application subsequently because the fact that they had got huge orders from outside and they could not supply any more vaccines to countries like India. So we need to see what is the available vaccines internationally, and if they are available, we should try and take them as early as possible. That includes vaccines which are still coming out, like the Johnson's vaccine or others. Sputnik already has been given approval today, so I am very hopeful that in the next few days that will also get added on to the vaccine doses and will help in really ramping up the number of doses that is available. But I still like to stress, vaccine alone will not solve the problem, because vaccine will prevent you from disease. It may not prevent you from infection. The person will still get the infection and spread it to others. So COVID appropriate behavior, preventing crowds, is more important than just the vaccine. The vaccine effect will take a few months. We may take, by that time, if we start having everyday 1.5 to 2 lakh cases, we will have a huge challenge as far as the healthcare facility is concerned. We can't have 2 lakh cases every day for the next 1 month. That will really create a huge problem. So we need to aggressively work on COVID appropriate behavior and having no crowds, containment zones.
No,
in the
but
past,
there do you think, Dr. Trehan, the netas are setting a wrong example when, for example, governments in Uttarakhand don't ban the Kumbh because it's a religious festival, nobody wants to mess with the, the sentiments of people, therefore you say, okay, you have your Shahi Snan and lakhs of people congregate, or as they do at rallies. You're asking all of us to be careful at work, at factories, at workplaces, offices, but look at what's happening out in the elections or look at what's happening in these religious gatherings. And nobody seems to be having a problem with that. Shouldn't everybody rise and say, for heaven's sakes, don't allow this because this could turn out to be a very significant super spreader?
Well, the basic thing that you must understand is that we as citizens can only come up with solutions which we have any control over. So first of all, everybody has talked about vaccine. Definitely vaccine is to be ramped up at any cost that we must produce it. 2, the fact again remains, like Dr. Guleria and previous speakers said, that look, vaccine alone is not the solution, it's not a cure. Please understand that. It will help to prevent serious disease. It will help for death, against death, yes. But unless for the next year or so, we practice safe behavior, we are going to be in serious trouble. Now you're right that these events are super spreaders, most definitely, and people who are attending these rallies are not wearing masks. So we need to enforce it. The private sector, the government, every public institution. We need to we put out on a daily basis, and I must compliment the media that you people have been at it also. Day and night, every channel is actually bringing the message very clearly that life is to be preserved. Yes, it's also said all around that economically it will be disastrous to shut down the country again. So short of that, we should all be realizing our own responsibility at every level, no matter what walk of life you're from. So these 2 things are the most important things to be given up. And definitely the government can clamp down.
Now, Mr. Narendran, I was seeing some data compiled by our data intelligence unit about the R rate or the reproduction rate of the virus, which now seems to suggest that the virus is reproducing fastest in states like Bihar, like Jharkhand, where you have significant interest, and in Uttar Pradesh. Now, how much of a concern is that? And do you have a plan in place for factories to function when there's a virus spreading through the countryside and yet ensure that your workers remain safe? Is that at all possible? How do you intend to or hope to do that, Mr. Narendran?
No, I think it's possible, Rahul. It has happened in the past, and we have very, very strong protocols in place. We do extensive testing. Nobody can get into our factories without being tested. We have very strong contact tracing norms. We have a concept of having pods where people work in teams and they cannot different teams cannot get together, so so that you're insulated within that team. So there are many protocols which are in place. We use a lot of analytics to look at whether people are following social distancing, because everyone has an RFID card. So if there's a group gathering somewhere in the factory, we get to know. So that's why the factories actually are much safer than the cities outside, and that's why we are able to control the spread of the virus within the factories. And I think many industries or many factories are following those protocols, and that's why we say that factories are safer than you would imagine. And closing them is maybe to give a message, but I don't think it solves the problem. It creates a problem of livelihoods without solving the problem of lives.
Mr. Bajaj, how much of an impact will this have on economic outlook? I was interviewing Dr. Geeta Gopinath of the IMF just last week, and there the sense from the IMF was that things are looking up, things are getting better. India projected to grow at 12.5%. At this moment, the mood in India is very different from the US and the UK, where they're now looking at advancing the timelines at which they open up or scale up, whereas now we're thinking in quite the contrary terms of restricting movement, heading towards some kind of restrictions. How does this impact economic outlook?
So Rahul, it all depends on how we act now and how we act over the next 60 days. The mood in India till very recently was also very positive. We came out of the first wave and things across most businesses, other than the few that we know of, have been very positive. And as we've discussed, that the current wave has escalated still in small pockets. And maybe Maharashtra is one big state, Punjab is, but otherwise in smaller pockets. We need all the action now. And as the doctors are saying, practice the safe distancing, wear your mask. Each individual, each Indian, this is about each one of us. This is not about others. So we have to take that action. We have to get the vaccines going. Because even if we, as everybody said, if we act today, it will take a few weeks, it may take a month to get that to happen. So we have to focus right now on making sure that the gatherings don't happen. We each are responsible with our distancing, getting the vaccine production, supply and distribution up. And hopefully we can contain this in the next, overall in the next 45 to 60 days, and we don't have to worry about the economy.
Mr. Banerjee, 2020 was a write-off for large parts of India Inc. Several sectors very deeply impacted. Just as everyone was trying to pick the threads, start looking at growth projections again, look at what they were going to do in the year forward, you've now got the virus spiraling out of control with no clear end time. Some of the epidemiologists we spoke to said maybe by the end of May the numbers will start dipping, but that adds a lot of business uncertainty. What's the best way, according to you, of dealing with this uncertainty which now confronts us?
So, one of the data points which I was seeing is the top 5 states with the highest active COVID cases account for a third of India's non-farm economy and over 75% of the active COVID cases. So this really lends to adds to the uncertainty to the domestic growth outlook, and especially amid the restrictions of many state governments. So what we really need is a very strong, very strong sort of a commitment from all stakeholders of the society, in terms of a very strict regulatory framework in terms of, yes, wear masks, social distancing, observe protocols at all places, very important. So if you really look at the points that we are talking about, is not only just creating these protocols, but a very strong way of enforcing these protocols. All safety, hygiene and health protocols to be very strictly followed across in all areas. So, and also, what we are saying is that things like public transport, metros, trains, buses, there should be restrictions on the number of people that are allowed to enter them. We need to monitor them, and industry shoulders as to how we can vaccinate more communities after looking at the supply side and production. We should see industry's responsibility not only by vaccinating their own people, but also their families and also communities, so that we can do that. So I think there is a shared responsibility at this point in time. There is a lot of concern. So we need the momentum, which we saw the green shoots. We are seeing them. We should sustain them. We should nurture them by giving that confidence, but not by ad hoc decisions of lockdown, etc., but by seeing that how we can all be responsible. And I think that itself is a very strong way of countering the challenges that face each and every section of the society.
Mr. Kotak, Chandrajit Banerjee makes an important point about the need to nurture the green shoots. Are you concerned that all this uncertainty, this volatility, will now lead to those green shoots being stomped, and again people retreat, fall into a trench-like mentality, and they're just looking for the COVID bullets that are passing over their head, and 2021 could also end up being a write-off?
Rahul, when the going gets tough, tough get going. And it's a true test for every Indian, how tough we are in a tough situation. And it is here that we need to rise above individual petty differences, issues which bog down our progress. Centers, states, manufacturers, buyers, public gatherings. Let us rise above our narrow issues to clearly saving India this time around. And we must do it now as one India, and every Indian as an individual must have a commitment to making this happen.
Dr. Guleria, You're part of the government's task force. Can you share your projections at this time about when you see this wave come under control? Because this wave was unanticipated. At least the government didn't tell us in public that they thought the cases would spiral in the way that they did. So to that extent, the public can think the government and practitioners were caught off guard. Is there any sense at this moment, or can you share your best sense about when you see cases starting to come under control?
So this wave is very similar to the waves if you look at the 1918 pandemic. There were 3 waves then also, and the second wave which we're seeing right now was the biggest wave. And that happened exactly for the same reason that it has happened this time. That in 1918, people felt that the influenza pandemic is over, and they started celebrating, having parties and having get-togethers. This led to a huge peak, and that was a time when there was no vaccine, there was no antibiotics, and a huge number of people in India also died during the British time. So this may last for the next few weeks. I think at least for about 4 to 6 weeks. But a lot depends how well behaved the citizens of India are. If we follow good COVID appropriate behavior, if we prevent crowds, and if we are able to break the chain of transmission, the peak will not be that big, and we will be able to bring it down much more earlier.
Do you think this is where governments need to take tough decisions? For example, putting a hold on the Kumbh in the manner in which that it's being held at this time?
Yes, all activities which can be super spreading events should be sort of stopped. We should also look at very good surveillance or aggressive surveillance data. In the past, we had developed strategies of what we used to call red zone, yellow zone and green zone, and all those areas where there is a huge surge of cases should have some degree of containment. We should try and decrease the cases there and not allow them to spread from that area to other parts of the country where things are still much better off.
How do you, Dr. Trehan, how in your view is this wave different from the first wave that we saw? We've now heard of young children being hospitalized with COVID. We've heard of repeat cases, people who've had the vaccine, even if several weeks have passed after both the doses, still ending up with the virus. How would you suggest, given all the uncertainty, conflicting information, WhatsApp University being at overplay, how do you suggest people be dealing with this uncertainty?
So, it all comes down to the same factors that everybody's talked about. But one thing that is a fallacy, I think, is to say there are some states which are raging and the others are okay. It's not going to be so forever. People are traveling in between. What is raging today will transfer to the next state, Like Delhi was slow in starting, but you see what's happened to Delhi. You can't find a bed in Delhi or even in the surrounding, in the NCR area. So, the basic thing is there should be no wishful thinking. There has to be, testing has to go up even higher than what we did in the first wave. Tracing has to be done because some states have an advantage today where it's not reached that proportion yet. If those states and those cities and those clusters actually start taking the precautionary measures like happened in the lockdown, without the lockdown, we may be able to actually check quite a lot of the spread. That is one. So whatever we can do humanly possible together, like has been repeated again, government, private, caste, creed, religion should not be anywhere near us. We need to all put our heads together. It should be a prescribed behavior form, almost like a martial state for the next 4 to 6 weeks. And then we should, there are some misplaced concerns. Like somebody said earlier, why are we challaning people driving alone in their own car with their air conditioning, which is they are breathing the air, and you say you must wear your mask. And outside where they stop the people, there are 100 people walking by without a mask.
Okay.
So these things have to be thought through properly. You can't willy-nilly throw up rules which have no meaning. So I think we need to really have a proper debate, a national debate to say, where are we at? The suggestion of red, green and yellow zones is very important. We need to go back to the drawing board. This is going to keep surging. Some estimates are it is going to stop and go up to 3 lakh a day. And it's very possible that that's going to happen. So if we are going to be staring such a grim situation in front of us, I think we better get our act together. This debate should be just the beginning of the fact that everybody put their head together. We did before. When we did the lockdown, when in the first wave, we had much more dialogue and much more cooperation across the board. Today, we are still grappling with it. And I think it's not too late. We have the challenges are there. We just need to put our heads together.
This is, if
and
ever
actually
there
the
was
solution
a
level.
matter of life and death. Of that, there can be absolutely no doubt. And I'm glad that on this broadcast, we've been able to put out some positive, tangible ideas about how to deal with the situation. Just locking yourself up is not the solution. Finding effective, meaningful ways of being able to ensure that there are genuine clampdowns. And I think the onus is equally on everyone. You can't say in a car, have your mask on, but then you have a religious congregation of the kind that's taking place at Haridwar. And I'm glad that Dr. Guleria called it out and said there has to be a stop to all religious events, political gatherings. You can't say it's okay because it's not. You're playing around with everyone's life. For the time being, Mr. Uday Kotak, TV Narendran, Sanjiv Bajaj, Chandrajit Banerjee, Dr. N Trehan and Dr. Guleria for joining us in this very high-powered, high-quality conversation in the news track. Thank you very much. I deeply appreciate your time and your insights. Thank you.